And welcome to another edition of KellumConnectMD.com. Minute Gabe Farias, Dr. Danny Kellum.
Hey,
it's been a couple of weeks.
It's been really sad to be missing you.
I know, right? You gave me like the longest hug.
It was terrible.
It was a little awkward. I'm not going to lie.
I just didn't know when to let go.
And you even warned me. You said, I'm not going to lie. It's going to be a little weird.
So
it's going to be a little
Get
weird.
ready.
Come on in here. Come on in here. Come on. It was when you started smelling my neck. That's when I really...
Was that weird?
Yes, that's when it got a little weird. Dr. Kellum,
Next
of
time
course.
will be better.
Of course, these broadcasts are
It didn't
presented...
smell that good,
It didn't.
just for the record.
It's Ben Gay Sport, folks. That's my choice of fragrance.
Aqua Velva.
That's right. Fabergé. What was it? What was the Fabergé stuff? Not Old Spice, not Aqua Velva. Brute. Was wearing the Brute.
That was it. That's why I had no dates in high school.
Now that we gave you this ridiculous piece of our morning, let me tell you, this broadcast is brought to you by KellumConnectMD.com. What a cool service. $49.95. You visit KellumConnectMD.com. You can see a provider in just a few minutes from the luxury of your home, your office, your backyard. Only $49.95. But if you enter the coupon code SCHOOL, you get a $10 off discount. And Dr. Kellum, this is a great service that you offer here at Kellum Family
Sure
Medicine.
is. It's something that we're very proud of. We've been going on now for about 2 years. But it's a wonderful way for people on the go with very little time, moms who are running their kids all around all the time. When they get sick, to get on Kellum Connect MD, very simple, $39.95 with the coupon code SCHOOL, and be able to be face-to-face with a provider. Quick, easy, and an easy way to get cared for.
And we've set this up. It's incredibly easy. It's incredibly simple. You visit the website and then just follow the directions. We send you emails that'll really get you right to a provider. You've had everyone from teenagers to the elderly using this service, talking about how cool this is.
Absolutely, and it's interesting because you thought that this would certainly be a tool that younger people
Millennials. I would think it would be a tool for millennials,
Sure.
but that's not the case.
Absolutely not the case, and it's so very simple that any age group really has been able to do it very simply, and have been very pleased with the ease and convenience that comes with Kellum Connect MD.
Okay, the other day came in, got some blood work. Wasn't feeling too well, so I scheduled an appointment. Came in, I saw. Right off the bat, I was told, wow, your blood pressure is incredibly high. Do you have stress in your life? And I just kind of smiled as my left eye twitched a little bit. My facial expression answered that question. But yeah, there's a lot of stress in my life, as there is with a lot of different folks. Do you eat right? Well, I eat right-ish. Turns out I had a hypertension issue. I was able to talk to you about it. We were able to get it under control with medication. Talk about hypertension and how that affects people in their everyday lives.
You know, it's very, very important actually to control high blood pressure, especially here in South Texas. Often our population here is suffering from hypertension, they suffer from diabetes issues, they suffer from cholesterol issues, and it's important to mitigate risk factors, because what we're trying to do ultimately with this is to limit strokes and limit heart disease in most individuals. And in hypertension in particular, it's one of those things that we treat, but I don't think we always necessarily treat to the degree that we need to, and mainly because people don't necessarily care for medication. And what I would say with that is really lifestyle modifications are the way to go. Cutting salt is always a good thing. Exercise is a wonderful thing to do to make a difference with that. Cutting carbs and sugars are a wonderful way of making a difference with things. And as we condition our cardiovascular system, hypertension tends to get much better. The other thing is that when you look at some of the guidelines that are laid out by American College of Cardiology and such, they recommend lower blood pressures. And that seems like a relatively simple statement to make, but in the past we've used blood pressures of 140/90 as an indication of high blood pressure, but now those numbers are down to 130/80, which really tells you the importance of being a lot more aggressive in treating blood pressure.
And in some cases, when you're on that marginalized kind of area, it might be as simple as a low-dose beta blocker or even a baby aspirin. Just get checked so that if your blood pressure does get out of hand, you are kind of ahead of the game, if you will.
Absolutely. Those things make a huge difference. So medications today are very simple, very safe, very well tolerated, and very effective. And often in good lifestyles, you don't necessarily need a lot of medication to make a difference, but enough to just bring those numbers down. And I will tell you from our perspective as preventative care doctors, we look at things like omega-3 fatty acids, we look at things like turmeric, we look at things like exercise, we look at things like cutting gluten, carbs, and sugars, because when we create diminished inflammation within the body, in particular in the vascular system, what we get is stronger vasculature, which means less likely risk of stroke, less likely risk of heart issues down the line, and certainly much better quality of life for individuals a lot longer into their life.
And it's as simple as getting a physical, making sure you're checked on a regular basis. It doesn't matter if you're 18 years old or 80 years old. Get checked regularly. Set up your annual visits. Set up your, every 6-month visits to just make sure. It's like a car. They want to make sure that a car is running well. They don't want you to come in to replace a transmission. They want you to come in just to get maintenance on your car. Same thing with the human body.
Absolutely.
Get checked.
Absolutely. And it would be something that I think is wise for everyone to do at least once a year. And it kind of goes back to I think really knowing your numbers, and it's something that I think we will begin to push here more with Kellum Connect MD and Kellum Family Medicine, is know your cholesterol, know your blood pressure, know your hemoglobin A1C, know where those numbers are, because those are the numbers that we use to guide our health long term. And if people are aware and understand, they're much better advocates for their health, and it creates a much better partnership for us to be able to hit objectives and to certainly reduce risk down the line.
All right, and you can set up an appointment here at Kellum Family Medicine by just calling 210-945-2121. Also visit our website, KellumFamilyMedicine.com. Also visit our Facebook page. You can get in touch with us any of those ways. We'll set up an appointment for you to come down. But if you cannot leave your home, or you're busy, or you just want to get checked for the flu or cold, or just any type of medical information, KellumConnectMD.com is the place to visit. Enter the coupon code GETWELL. You're going to get $10 off of your visit. Dr. Kellum, it's an easy way to see a provider without leaving your home.
Absolutely. KellumConnectMD.com makes it simple, easy, and affordable for your health care.
All right, folks, that's going to wrap up this edition on the Kellum Connect MD.com Minute. For Dr. Danny Kellum, I'm Gabe Farias. Folks, enjoy the rest of your weekend.